morning, good evening, good afternoon, wherever you are. Welcome to Vivekananda Yoga University, the first yoga university outside India doing graduate education research. My name is Prashant Joshi. I'm here in Austin, Texas. I'm your host, and we're very delighted to have a very esteemed speaker today in our Distinguished Speaker Series webinar. We are a thought leader, and we bring thought leaders to bear. So, all right, with that, so let me quickly introduce our speaker. And this is Dr. Indranill Basu-Ray, as a senior interventional cardiac electrophysiologist and a medical researcher based in Memphis, Tennessee. He currently directs the clinical cardiac electrophysiology laboratory and cardiovascular research at the Memphis VA Medical Center. And I'll just again make it short, but he's a awesome faculty at YU. He's an honorary member of our faculty senate. He again is a very, very renowned cardiologist, but more importantly, he's a Kriya Yogi and a dear friend and a colleague here. So extensive research and his clinical yoga therapy is a very, very relevant topic for all of us. So what he'll be sharing is basically all about the integrated and lifestyle medicine, which is gaining traction in the mainstream healthcare. Remember, we're talking human care now versus just a disease care. So clinical yoga therapy is emerging as a relevant and credible adjunct to the US healthcare system. So his talk will explore the utility of clinical yoga therapy. Again, this is all very relevant for as a career. So important that this topic is here. So again, the title is Clinical Yoga Therapy in the US, Relevance, Recognition, and Career Utility Today. So without further ado, I will give the floor to Dr. Indranill Basu-Ray.
Thank you, Prashantji. Thank you very much, Prashantji. Good morning, good afternoon, good evening, wherever you guys are. It's a pleasure to be with you guys today. So let me share my screen. We are going to talk about, can you guys see my screen?
Yes.
So what I'm going to talk about is clinical yoga therapy in the US. What is the relevance? How is it recognized? And what is the utility in having it as a career? What I'll try to do in this study is not only show you at the end of my talk, you will understand that yoga has become a part and parcel of modern medical treatment, whether it is for cardiovascular disease, whether it is for cancer, whether it is for arthritis or other musculoskeletal disease, or whether it is for mental diseases. These four constitute almost 99% of diseases that kill people on a daily basis. Not only that, we'll also discuss about what is the future of yoga as a career here in USA. What is the future of and the utility? What are the job openings that you can expect? And because we at YU, we are coming out with, we already have 3 courses, which are core courses. People who want to do clinical yoga therapy, we have 3 courses for that, and we have 2 more courses coming up shortly. And these 5 courses can help anybody to be a clinical yoga therapist and get a job as a physician, as a nutritionist, as a dietitian. Doesn't matter what profession you are, but just the addition of clinical yoga therapy will take you to the next paradigm. So without wasting much time, let's go through them. Heart disease is one of the largest killers in the world. In America, last year, almost 700,000 people died because of heart disease. And by the time I started this talk, which is a couple of minutes, maybe almost 2 to 3 of Americans must have died, because every 40 seconds, somebody is dying in the US because of heart disease or having a heart attack in the US. Half of the country's population has high blood pressure. And similarly, half of the people in this planet have high blood pressure. 3/4 of the individual in this country have obesity, and that too, these 3/4 is based on old data, because if modern data is taken into account, where the BMI is less than 25, then possibly 85% of American population is overweight. 57% of US adults have type 2 diabetes or pre-diabetes. And as most of you probably know, nobody dies because of diabetes. They die because of heart attack or stroke. So the largest killer for diabetic people is stroke. The largest killer for arthritis is heart disease. So heart disease is the final endpoint for a large number of deaths all over the world. So obviously the health impact of these diseases are massive. And it is projected by 2015, the annual healthcare will be around $2 trillion. So you can very well imagine if you are a clinical yoga therapist working in the field of heart disease or cancer or musculoskeletal diseases or even mental disease, you are going to be part of $3 to 4 trillion market that is going to be in vogue in the next 10 to 15 years. I'll explain to you how, but before that, let's get a basic understanding of what we are dealing with. So if you look at the 2025 update, as I said, that out of 100,000 people, 300 people die because of heart disease. Huge number. And this number, unfortunately, is not very updated. This number is based on 2022. Today, it may be 350 or even 400 plus thousand. As I said, 3/4 of our population are overweight. Overweight leads to heart attack, stroke, name it. Every bad things known to mankind, overweight can make you have that. We have millions having diabetes. And the people who have diabetes are just tip of the iceberg. As you know, in any iceberg, 9 out of 10 is under the water. So 9 out of 10 is undiagnosed. And those are millions of people with either diabetes who have not been diagnosed or pre-diabetes who are on the verge of being diabetic soon. It doesn't matter because all of them have coronary artery disease and all of them are ultimately going to suffer from some form of coronary artery disease or heart disease or have an event that is because of heart disease. So with this sort of a malignant picture, it's very important to understand where yoga comes, because medicine treats heart disease. Modern medicine prevents future attacks, but they cannot cure anything. If you want to get your diabetes under control, you have to follow yoga. You have to do a diet. You have to sleep better. You have to reduce your stress. You can take all the medication known to mankind. You can pump yourself with more and more insulin. That actually will make you more and more overweight and increase your risk also. So none of these actually help, and that's what we are going to learn today. Majority of the disease are preventable. Whether it's cardiovascular disease, you need to have the appropriate diet, you need to increase your activity, you need to stop smoking, stop taking alcohol. If you have cancer, same, diet, tobacco, environmental exposure. Diabetes, obesity, diet, inactivity. So every known modern disease has a huge component that is treated not by drugs, not by bypass surgeries, not by giving them artificial heart or an artificial kidney, but by following simple lifestyle. And that's where you as clinical yoga therapist comes into play, and that's what we're going to discuss today. Mental disease is a huge problem in this country. 23% of adults have mental disease. 16% of Asian adults have heart disease, and that's a huge number. 1/4 of black adults have 1/4 of black adults, 1/4 of Hispanic adults have mental diseases. That's a huge number. 50% of people who are lesbian, gay, or bisexual, 50%, and that's as you can understand, it's a huge statistics. They have mental diseases. So mental disease is ingrained into the population at multiple levels. And yoga is evidence-based adjunct therapy to mental health. Very, very important to understand the word. If you're a clinical yoga therapist, you will be performing what is called evidence-based medicine, because you're not going to do yoga in a mental health patient because you think that the patient will benefit, or that person who's taking the yoga therapy from you benefits. But it is based on actual evidence by medical research, and that's very important to understand. And almost all the common condition, whether it's a depressive illness, whether it's a general anxiety disorder, schizophrenia, sleep and stress is ubiquitous. I think 99% of our population have stress, and things have got worse. There is two wars going on, one in Gaza, one in Israel, one in Ukraine. We just had a war between India and Pakistan. So there's war going on. Couple of million people in this country was thrown out of their jobs in the last 1 year. Biggest corporation, Amazon, Google, they kicked out people. So stress levels and is highest in the world today, and so in America. That's where you, as clinical yoga therapist, will have a massive role to play in the coming future. Cancer, second biggest killer, kills half the number of people as cardiovascular disease, but increasing in number. Breast cancer, one of the commonest cancer in females. Prostate cancer, commonest cancer in males. Unfortunately, the numbers are increasing. And what is even more unfortunate is we are also having more and more kids developing with different types of cancers like leukemia. We don't know the reason why, but that's the truth. And in all these, as you will see, we are going to talk a little more that clinical yoga therapy has a big role, and you, as a clinical yoga therapist, whether you're trained in the US or if you're trained outside the US, will have a dominant role to play, because millions of dollars are being spent for these diseases. And it will be, I don't know how many of you know, all the top cancer hospitals in the world, whether it's MD Anderson, world's number one, Sloan Kettering, world's number two, Dana-Farber at Harvard, world's number three, everybody has a department that teaches patients with yoga. Every patient with breast cancer that goes through MD Anderson, world's number one cancer hospital, gets trained in yoga, gets trained in meditation, so that you can control the stress, you can control the bad effects of anti-cancer drugs and bunch of other things. So it's very important to know this billions of dollars of expenditure that is coming in. These expenditures are slowly getting rediverted to what we call integrative medicine. I do not like the word complementary medicine, because yoga, lifestyle medicine do not complement. They are part of the medicine itself. If you need an anti-cancer drug, it has to have side effect. If it has to have side effect, patient has to do decrease stress, so you need yoga. Patient has to sleep better, so you need yoga. You have to stop the hairs from falling off, you have to stop the vomiting. For everything you need yoga, and these are based on actual research, not just because I believe or you believe that yoga works. So it's very important to understand. Next biggest is arthritis. America and the entire Western nation is an aging population. Some countries like Sweden, inherent Sweden population, they have negative growth rate. Like there are hundreds and thousands of couples in Sweden who don't have a children, and their ages are increasing. So musculoskeletal disorder and arthritis is a big problem. And America, almost 50 to 60 million adults suffer from some problem or the other. 1 in 5 have doctor diagnosed arthritis, and there are 10 times that number who do not have doctor diagnosed, but they still suffer pain. It could be back pain, it could be neck pain, it could be pain in their joints. And millions of dollars are spent on these drugs. And a large part of that, over $6 trillion, are spent on curing these diseases, and a large bulk of that are spent by people from their pocket for alternative therapy. That's a very important part. People spend billions of dollars out of their pocket for alternate therapy. If you're a trained clinical yoga therapist, you're going to be part and parcel of that market and treat people and treat these conditions. So the economic burden, as I said, is huge. Over $500 billion is spent every year. And the healthcare cost will includes does not include people who spend out of their pockets. This is what people spend through insurance companies. But as you know, a lot of people spend tons of money, twice this amount out of their pocket for healthcare because they know that their insurance is not going to cover yoga. If they go to a lifestyle practitioner, they are not going to get covered. So they spend it from their own pocket. So that's a huge market, and we'll talk about this. So coming back, I just gave you a basic understanding of the different diseases that we are dealing with in the modern era. So in modern era, 75% of the death or even 80% of the death is due to what we call lifestyle diseases. And that is caused by unhealthy eating, physical inactivity, smoking and heavy alcohol intake, poor sleep routine. I'm too busy. I have no time to sleep. I sleep 4 hours a day. That doesn't happen. If you sleep 4 hours a day, you're damaging your brain, you're damaging your body. You have inflammation, and that inflammation will lead to regular heart attacks. Inflammation can also lead to cancer. You have obesity because you're eating too much, and because of stress, you're eating too much, you get obese. And then you want to control your diabetes, so you start taking insulin, which makes you more obese. So these are medications is not an answer. The answer is changing your lifestyle. And urbanization doesn't make things better, it actually makes things worse. And that's how it happens. So, what is this new thing called lifestyle medicine or personalized medicine? So, lifestyle medicine is a medical specialty that uses evidence based intervention. Again, for every clinical yoga therapist, I want to make it very clear that everything that I'm talking today, everything that you're going to speak, is based on clinical evidence through research by people who are physician or scientists. They may not know anything about yoga, but they have done research in yoga and they have proved that yoga works. There are hundreds of doctors there who have never been to India. They never know what yoga is. They don't understand what yoga is. But what they did is, because they are physicians and they are scientists, they did double blind trials to show that yoga works. And that's how there are hundreds and thousands of papers on these varieties of diseases and how they are treated using yoga. I'll talk a little bit about that more. So, why does yoga matter and in lifestyle medicine? Because yoga is one of the most researched topic in medicine today. I am proud to say that I belong to a branch of medicine which is possibly the most researched, and that is cardiology. But it will not be long before yoga beats us. Why? Every day I am seeing thousands of papers coming out from all over the world with hardcore research on yoga. Take, for example, in 2017, I was one of the three cardiologists I was called to write up the guidelines by the American Heart Association, the world's largest body of cardiovascular disease specialists, cardiovascular surgeons, vascular medicine specialists, and vascular surgeons. So we had to read over 4,000 articles just to write the guidelines. The guidelines was read by over 2 million people. It was published in hundreds and thousands of newspapers all over the world. It was translated in, I don't know, maybe 15, 16 languages, starting from French, Spanish, Germany. And this is the first time a modern medicine institution of importance like American Heart Association has practiced guidelines on the role of meditation on cardiovascular disease. So yoga, now we know, combines breath work, meditation, relaxation, movements that prevents you, also treats from heart disease, diabetes, obesity. At the end of my talk, I'll show you our two books where each of the books are written. The first book is written by over 75 authors from Harvard, from Emory. And each chapter, whether it's chapter on blood pressure, whether it's chapter on glucose control, whether it's chapter on cholesterol, there are thousands of articles which we have quoted to show how powerful the science is and that we have researched. Now, just for the sake of today's talk, I cannot talk about evidence in every disease. That will the talk will last forever then, but for the sake of brevity, I picked up cancer here. So yoga plays a adjunct role in cancer, and yoga that's based on, as I said, almost all cancer hospital today has yoga departments. There are multiple researchers, and it is evidence based through hundreds of research. We know it reduces fatigue of cancer chemotherapy, it reduces anxiety when somebody has cancer, not only of the patient but also his caregivers. If your wife has cancer, it's the husband. If the husband has cancer, it's the wife. If the son has cancer, it is the mother. So it helps the entire family. It is not restricted to the patient itself. It changes depression. It improves sleep disturbances. It decreases pain. And the biggest advantage is which no modern medicine, you can spend trillions of dollars, but there's no modern medicine that I can give you that will improve your overall quality of life. But meditation, yoga does. And that's why it is recommended by leading oncology guidelines. And that is very important. I'll show you a slide for that. But before I go to that, let you guys understand how it helps. It helps with fatigue. It helps with mood and sleep, pain and stiffness. And these are based on guideline. SIO, ASCO, these are all cancer organization. This is not based on Dr. Basu-Ray because he teaches yoga, or X, Y, and Z because they practice yoga. No, these are made by physicians, organization having hundreds and thousands of cancer specialists who sat down and found out that this is important. Like aromatase inhibitor used in elderly breast cancer patients. Breast cancer is the largest cancer, killing thousands of women in America today. And in those, they use a drug called aromatase inhibitors, and those cause arthralgia, post treatment, a bunch of problems. And they are treated not by another medicine, but by yoga. And you, as a clinical yoga therapist, you'll be learning these and how you can not only treat these patients, but these patients will be sent to you and you'll be a consultant both in treating, creating the treatment pattern, as well as rendering treatment to hundreds and thousands of patients. So as I said, there are multiple actionable benefits. It decreases blood pressure, decreases cholesterol, improves blood sugar, diabetes gets controlled, gets you better mood, prevents depression, schizophrenia, anxiety, stress, and overall it prevents inflammation. The core cause of all heart disease, if I have to use one word, and that is inflammation. There are hundreds of studies, just 6 to 12 weeks of yoga reduces inflammation. Your chance of having heart attack, your chance of getting stroke, your chance of getting uncontrolled diabetes, everything is reduced. So yoga's indication into the healthcare system based on multiple study has shown it increases patient satisfaction. Modern medicine has accepted yoga not because they just needed something else. Modern medicine has found out that medicine itself works, but only to an extremely limited extent. If you want to provide better cure, if you want to promote long-term recovery, if you want to foster healthy behavior to prevent further disease, you have to go for yoga. So, as I said, these are based on guidelines. And that's important. In America, I can believe whatever I want to believe. Nobody's going to stop me. But nobody else is going to believe what I believe just because I believe it. It doesn't matter how important I am and how big a celebrity I am. So in America, for something to be accepted, you have to go through guidelines. And that's what this slide shows you. The top cancer organizations guideline actually strongly endorses, including National Institute of Health, the premier federal government body which funds research, strongly advocates the use of yoga for cancer medicine. Now, global yoga market is a huge market. It's over 200, expected to be by 230 around $200 billion, but it's expected to go over that, over $1 trillion by 2050. And these are expected to be conservative estimates because the increase is phenomenal. No other medical or non-medical, non-medical means things like acupuncture and all. Medical means medicine. Nothing beats the growth of yoga. Why? Let's understand the revenue stream. Today, if you're trained in clinical yoga therapy, what is the revenue stream that you can earn? So in 2024, people have earned $120 billion just from their in-person yoga studios and in-person yoga classes. Whether you sit at your home and give virtual classes or you have your own yoga studio, doesn't matter. $120 billion people have earned. That is projected to go to over $500 billion. That is $500 billion by 2035. So that is the money that you guys are going to earn if today you take clinical yoga therapy. From digital and online subscription, people nowadays have started doing yoga by joining Zoom. So there are teachers who literally mint money sitting in their own home. They don't have to go to a 9 to 5 job. They don't have to beat traffic and drive their car. They don't have to go to the stress of facing a boss who's always mad at you. They can sit in their home and earn millions if you are appropriately trained and you have a certificate that you are trained by a university training in CYT, that is clinical yoga therapy. Then there are teacher training and accreditation. There are multiple teacher training courses. Now we are having medical universities coming up that teach whole health. I'm going to show you a slide on that. Apparels. I mean, Lulu has earned billions of dollars just selling plain, simple yoga apparels. I mean, they buy it from China or Vietnam or India and they sell it in USA at 400 times the price and make money. So you guys as clinical yoga therapists who actually know what sort of yoga clothing is appropriate, what sort of mat is appropriate so that you don't get injury to your legs when you do a yoga posture, those things you can also do the same. Equipments are increasing every day. Almost $10 billion of equipment was used in 2023. So today it'll be more, and every year it is going to be increasing. Retreats and wellness tourism, huge market. The market is so huge that when I went to Chat GPT, I went to Perplexity to find out. They couldn't give us a number. Some people said it's over $6 billion. One study said it is over $20 billion. So I couldn't put a number there because what it says is that it all depends on where you are. People can go to India and have a 4 weeks course for just $2,000. People can have 1 day course for $2,000 here sitting in America. So it varies so much that nobody even has an idea how many billions of dollars people spend out of their pocket to have retreats and wellness tourism. And last but not least, don't forget corporate wellness. Almost all the top corporates, starting from Amazon, Google, they strongly recommend and they are paid to take part in corporate wellness program that includes virtual yoga or even on-site yoga program. Google actually in their own office have rooms where you can practice meditation, which they have for their own employees. So, what are the growth drivers? Today, if you do clinical yoga therapy from a university like Vayu, what do you, I mean, is it because I'm painting a great picture, that's why you should believe in me? Or is there actual statistics that show? So, let's understand that. So this massive growth that we are seeing, and I gave you the exact numbers, and if you don't believe my numbers, don't believe them. Just go and find out from Google. Put it in Chat GPT, put it in Perplexity, and you will see it. These are the actual numbers. There are numbers from top medical journals like Circulation. There are American Cancer Society journals. There is from the American Cancer Society. Go to their homepage, see the numbers, and you will see. So the demand is growing because slowly we in medicine, like I am trained in modern medicine, I have understood that in my subject, just like me in a cardiologist, similarly an oncologist, or a gastroenterologist, or a arthritic rheumatologist, have understood that medicine is only a part of the picture. It's just the trailer. If you want to see the whole movie, you have, which the whole movie means complete cure, you have to bring in yoga and lifestyle changes in the patient. Unless you do that, the patient is going to continue to suffer. Medication helps, but medication comes with cost, number one. Number two, and the cost is extreme. It's pretty high. There are hundreds of people in this country who don't even have insurance. They cannot afford that cost, number one. But even if you can afford that cost, the cost is not without severe adverse effects. But here you have yoga, which you can sit in your sofa and do, not pay for it, don't go to a doctor, don't pay tons of money for your insurance, at the same time, stay healthy and prevent yourself from getting diseased. Secondly, the growth is being driven by the hybrid models. COVID introduced us to hybrid virtual models, and that has continued, whether by using apps. The use of apps has increased by 363 times since COVID. Before that, app use was next to zero. So, so this is a huge model for making money by sitting at your home and teaching what you know. Of course, you have to have an appropriate degree. You cannot be a class 8 fail or standard 8 fail who's teaching yoga just because you can bend your knees and bend your legs. That doesn't occur. Those days are gone actually, and thank goodness they are gone, because that is what is maligning yoga. Is we have uneducated, untrained people. See, yoga is part of a medical therapy. Yoga is not a religion. Yoga is not a ritual. Yoga is not voodoo medicine. Yoga is evidence based medicine therapy for cardiovascular disease, for rheumatology disease, for cancers. So you have to be trained, and you just cannot be a class 8 or a class 9 dropout who's just trying to do yoga because you can bend your leg or bend your neck. So that's a very important concept that you guys have to understand, the world has to understand, and that's how that education needs to be taken forward. Now, how do you become a lifestyle medicine professional? So it can be done in multiple ways. If you are physician licensed in US, you can get trained in clinical yoga therapy. We have 5 training programs. Through YU, we provide those. We'll talk about that shortly. If you are a foreign trained physician, you can take USMLE and do family medicine, internal medicine residency, and then train in COIT. If you're a foreign trained non-allopathic physician, or you're an American trained non-allopathic physician like naturopathy and all, you can still um, uh, practice by taking CYT. But if you're a foreign trained non-allopathic physician like an Ayurveda physician or a naturopathy physician, you cannot practice medicine in America, but you can certainly practice medicine in a little roundabout way, which is by becoming a PA, or either a physician assistant or an active advanced medical practitioner. Those courses are just 1 or 2 years courses. Once you finish then you do your CYT, and then you can have your own personal clinic. I know doctors I know people in California who charge $300 for a 15 minutes consult as a naturopathic PA or advanced clinical practitioner. They are not doctors. They were doctors in their country, but coming to this country, they just took a PA course and they have become they are practicing medicine. But of course, they are appropriately trained. They are not like somebody who's a school dropout and practicing yoga. So that's what it is. Non-physician can also have other relevant graduate degrees and approved CME hours. What does that mean? Maybe you're a nurse and you don't want to practice nursing, you want to practice as an advanced medical practitioner. Yes, you can do a CYT course and practice advanced practice. I know I have nurses who are my students who are in Columbia. Columbia University, their chief yoga therapist. You can become health coaches. There are hundreds of dietitians who come and take courses from us, and then they practice not only diet, along with diet, they practice lifestyle changes in their patients. And as I said, there are allied health professionals. These are nurses, massage therapists, occupational therapists, physiotherapists who are trained in clinical yoga therapy, and they have official license, and they can improve their earning multiple times just by doing a CYT or clinical yoga therapy. They can improve their income. So career opportunities is huge, and it is increasing every day. You can be a family medicine, internal medicine, preventive medicine doctor. You can be a nurse practitioner. You can be a physician assistant, health coaches, dietitian. You can be a researcher. You can be an administrator. There are The Veteran Administration is spending millions of dollars creating whole health all over all the VA hospitals in this country. So they are taking administrators who can administer whole health. There are medical schools coming up, and I'll show you a slide on that that has whole health as its primary treatment. So there are ways you can teach lifestyle medicine, you can teach preventive medicine, you can teach public health nutrition, you can be a community health worker learning clinical yoga therapy and extending your practice. Type of jobs with typical salary. You can nutritionist at least $70,000 to start with. Health and wellness coach $60 to $70,000. Community health worker $60,000. Public health administrator, and these are all starting salary. Don't forget that. 5 to 10 years will almost make it 1.5 times to double the salary. Physician salaries will widely depend. Like if you're working in a concierge, you can earn up to 350,000 just being a physician who's specifically trained in yoga therapy. So as I said, these are the these are the salaries from Glassdoor that I picked up. I myself did not know what the salaries are. So before passing it to you guys, I thought it is appropriate to go to the job sites and get you appropriate figures. So these are the appropriate figures on today. If you join today, this will be your basic salary. So this is some of the top paying jobs. As I said, you can practice a lifestyle medicine physician. You can practice as a medical director or a physician executive, like I said, like VA starting whole health program. And in those, you can become medical director. Obesity medicine is super, yeah, as I said, technically 67% of Americans are obese, but if you actually follow the WHO guideline, which says BMI of 23 or more should be called obese, then probably 87 to 90% of Americans are obese. So it's a big way, it's a big source of medicine. And as you know, these are not treated, obesity is not treated by drugs. Why? In fact, we just wrote an article in one of the world's top cardiovascular article, the role of yoga in obesity. People were surprised that in today's world, where you can have a drug called tirzepatide or Mounjaro or semaglutide or Ozempic to reduce weight, why would somebody do yoga? But that article of ours went viral. Why? Because you have to understand that to use these drugs, you have to spend over $1,000 to $2,000 every month, which is a huge amount of money. Millions of people in this country, at least two-thirds of the people in this country cannot afford that amount of extra money, especially when millions have lost their jobs in the last 1 year. Especially there is uncertainty going on. There are multiple wars going on. So they cannot afford. Even if you can afford, the problem is you take the you have to take the medication all your life. Why? A study with Mounjaro or tirzepatide has shown that after 7 months, when you stop the drug, in 7 months you grow back your weight. So you have to you have to have a budget where you're agreeing to spend $2,000 a month for the rest of your life. And that's not an easy decision to make, because you're going to get back fat again, obese again, if you leave the drug. Third, what is even worse, that these drugs kill your lean mass. How long you are going to live depends on your lean mass. How healthy are you when you're 86? Are you bedridden, or you're a young, healthy 86? Are you bedridden with severe dementia, or are you a young, healthy 91? Will depends on your muscle mass. Both these drugs, Ozempic as well as Mounjaro, kills your muscle mass. So with advantage, they have severe disadvantage also. Are these drugs useful? Absolutely. They are useful where they need to be. They were initially diagnosed, they were initially discovered not for obesity, but for diabetes, and they have saved the life of thousands of diabetic patients. But if you are using it for obesity, you have to be careful, because these are the problems. And that's why yoga or lifestyle changes has become so popular, that today, in the day of Mounjaro and in the days of Ozempic, our article on how to use yoga, you can go type my name in Google and you will get the link to the article, or you can follow up with us and you will get the article as to how yoga is not only a better solution, it's a permanent solution. So people come and tell me, Dr. Basu-Ray, I know you have a lot of experience, so you're absolutely right. But the problem is you have to do yoga forever to get thin. No, that's an absolute nonsense spread by, that's an absolute canard spread by people who absolutely no idea what they're talking about. 12 weeks, 6 to 12 weeks of yoga will start reducing your weight. If you add diet to it, if you decrease stress by practicing meditation, we actually are coming out with a book with 30 days plan how to decrease, how to bring down weight just by practice of yoga. So that's not true. Do not listen to non-scientific nonsense being propagated by people with vested interest who wants you to buy medicines, who wants you to go to a doctor, who wants you to have pay tons of money getting costlier and costlier medical insurances. I'm not saying you should not have medical insurance. I'm not saying you should not go to a doctor to stay healthy. You should. But at the same time, these diseases like obesity, cardiovascular disease needs lifestyle changes, which you as a CYT practitioner is going to teach and have it as your career. Public health lifestyle medicine administrator earns over 120,000 and at a basic level, and hundreds and thousands of universities are opening up departments of School of Public Health where you will have a job ready for you once you finish these courses. Now, it's also important to understand what are the barriers and how we can go over these barriers. And you guys who are going to take these courses are going to be future ambassadors. One is, yoga is slowly getting incorporated into the medical curriculum. Slowly. So 99% of doctors that you see have no clue about yoga. They think yoga is some voodoo and they don't believe in yoga. So I don't care whether you believe in yoga or not, because your belief doesn't help me or is not a problem to me, because yoga is supported by evidence-based medicine. There are journals of yoga, tons of research coming out every year. So if you're a physician who's dumb enough to believe yoga is some voodoo, then you need to get re-educated again about the science of yoga being an evidence-based medicine. And that's unfortunately is a big challenge. And slowly we are getting more and more places that are teaching these things in medical college. Second is time constraint. People going under medicine, as you know, is very intensive course, very saturated. There's very little time for additional subjects. Despite that, there are universities which slowly trying to incorporate yoga. We have taken part in multiple university and their deliberation so that they can slowly incorporate yoga as a mode of treatment. Now that starting from National Institute of Health, all the top bodies in this country officially support yoga, and yoga has possibly the most researched amongst all the other non-modern medicine or integrative medicine practices that we know. We need more qualified instructors. You have a school dropout who teaches yoga because he or she can bend their leg, bend their knees, bend their neck, do some funky esoteric postures. Yoga is not postures. Yoga is just 10% of asanas is just 10% of yoga. You have yama niyama. You have to follow certain rules. You have to sleep this much. You have to eat this much. You have to take the right diet. You have to have a yogic lifestyle. You have to practice concentration. You have to practice dharana. You have to practice meditation, which is dhyana. So there are 8 wings of yoga. The 7 wing, actually I call it 7 wings because the 8th wing is a state of existence which is called samadhi. But there are 7 different things that is incorporated into yoga for appropriate effect. And there has been research in each and every one of this. How does dieting help you? How does meditation help you? How does yoga plus asanas plus meditation help you? How does pure asanas help you? Everything helps. But when everything helps and you put them together, the help gets magnified millions of times. And that's what has been proved. And we need qualified instructors like you guys who will be doing clinical yoga therapy. Only then we can replace this uneducated, half educated, quarter educated fools who teach yoga and who believe they are great yoga instructors. No, they are not. Yoga is a form of clinical medicine, and you need to understand clinical medicine. Like, you cannot be a doctor in this country without a medical degree. And people who started acting as a doctor without being a doctor, as you know, they are sent into jail and they languish in jail the rest of their life. That's what should happen to people teaching yoga without appropriate clinical yoga therapy training, because you are not qualified to teach. You have to have clinical yoga therapy qualification, and that's where modern medicine is going to. There has been insufficient research and evidence in the past, but now there is a growing body of research which supports yoga's benefit. As I said, every day, for almost 8 years back in 2017, I was one of the 3 cardiologists from all over the world. We were asked to write the guidelines by the American Heart Association, as I told you, on the role of yoga in meditation. 8 years back, I had to go through over 4,000 journal articles to write the guidelines. Today, every year, over 1,000 new articles are coming out. So the amount of research in yoga is mind-boggling. And you guys, the new brand of clinical yoga therapists, is going to take it to a different level altogether. And so the future is much brighter than what even it is today. Third is the perceptual and cultural barriers. Oh, yoga is some form of religion. Yoga has got no religion, because the Bible of yoga, Patanjali Yoga Sutra, doesn't even talk about God. Show me one aphorism there which talks about God. And there are only 3 aphorisms which talks about physical yoga. And in America, physical yoga is the only yoga people know about. They don't know about diet, yogic diet. They don't know about niyama, yama, what lifestyle you need to follow. They don't know about pratyahara, which is concentration. They know a little bit about mindfulness, which is dharana. And they know very little about meditation, which is dhyana. So the perception needs to change, but you cannot change the perception if you are uneducated and you don't have the mental capacity to understand the medical concepts of yoga, which has been there for 10,000 years. And there are stereotypes and image issues, which is the biggest problem. That you have to be highly flexible, you have to be only a female, you have to have an athletic body. No, if I have an athletic body, then why would I practice yoga? Yes, I can practice yoga to keep fit. But if you have a disease, then also you need to practice yoga, because yoga will prevent you from further disease. As you know, we do a lot of research. One of our latest research paper that we sent to one of the world's top cardiovascular journals, not one of the world's top, the world's top cardiovascular journal, where we actually showed that for healthy people, muscular exercise helps, but for people with cardiovascular disease, yoga is a better medicine, better type of exercise. So research is bringing out miracles about yoga that we didn't even know in the past. So it's time to throw away stereotypes and image issues and pick up the modern variety of yoga, which is an evidence-based medical practice. There should not be any gender-based difference. It's not meant for females. It's not meant for males. It is not meant for people who just sit at home. It is meant for everybody. Name me one human being on the earth who I can promise will stay healthy. I can promise doesn't have to go to a doctor other than having regular physical checkups, never get admitted to a hospital with heart attack if they practice the full spectrum of yoga regularly in their life. Which human being will say, no, I'm not going to do that? People will tell you, I cannot do that. I'm busy. I'm stressed. My work. They'll give excuses, but nobody will tell you in this planet that they cannot do that. They might give excuses, but everybody would like to do that, because that is the paradigm where everybody wants to go. So we have to bring an attitudinal shift that from and behavioral changes. Unless you do that, the positive attitude that 300 million people have, yoga is the biggest practice in the world. There is no other practice, whether it's acupuncture or any other practice, that is practiced by over 300 million people worldwide. Over 57 million people in US. That too, that's an old, today maybe over 100 million people in US either do asana or do meditation or follow a yogic diet or do a combination of one or more of these. and 100 million is one third of American population. So this is the world's first school started by Alice Walton, the owner of Walmart, which focuses on medical education. You can see what a beautiful campus. So they will be taking hundreds of people as lecturers, as assistant professors, professors who are trained in yoga therapy. And like that, more and more existing universities are taking people at different levels as teachers, as practitioners, as clinical therapists. So sky is the limit for your job, getting job. Now, job setting. What are the job? I'm quite often asked by people, what sort of job setting you think, Dr. Basu-Ray, we can get? Multiple. Hospital and healthcare. And as I said, one of our students of Vayu, she did a PhD under me. She's now one of the top therapists in Colombia. There are hundreds of my students who have private practice in California, and some of them make $200 to $500 for one single patient. One single patient, one single visit. So sky is the limit. There are multiple working in rehabilitation centers. Show me one rehab center, just one, show me in the entire country, which is famous enough, whether it does rehabilitation for drugs or for alcohol or for whatever, that does not have a yoga train. Show me one. You'll not find even one. Why? Because yoga has become a part and parcel of every form of rehabilitation, whether it is rehabilitation after having a heart attack, whether it is rehabilitation because of drug addiction, whether it is rehabilitation because of smoking, whether it is rehabilitation because of alcohol. Every top rehab center in this country has yoga. So, and these are increasing in numbers. Every day you have a new popping up in everywhere. Small cities, micro cities, villages, they are popping up because they make money. So there's less competition. So people want to go there. Corporate wellness program. Billions of dollars have been put in by corporates, Meta, Amazon, Microsoft, for their own employees to get them into wellness programs. And there are hundreds and thousands of non-profit organizations that not only fund research, they employ people, and they propagate the use of yoga services to the community to address public health needs. And of course, yoga studios. I am told just there are 82 or more yoga studios in southern Los Angeles. They themselves together make around $1 billion just in that small community. Over $1 billion. I'm told that. I don't know if this is a true figure or not, but that, I mean, there are yoga studios which charge you $125 for a 1 hour yoga studio session. So that's the amount of money people can make. And these money, remembers, are not being made by clinical yoga therapists like you guys who are going to be, but by uneducated, half educated, quarter educated school dropouts, just because they can practice some poses. And practicing poses, as I told you, I want to repeat again, is just a small part of yoga. So career paths, multiple: yoga therapist, wellness coach, rehab specialist, corporate wellness trainer, consultants, name it. Every color, every shade of work is out there open for you. And thankfully, 99.9% of these are not saturated, and they are increasing in number every day. And that's why it's an open path. You can take whatever you want to be, whatever lifestyle you want to follow, whichever part of the country you want to live in, even abroad. Whether it's not only about America, it's about all the Western nation, it's about India. Everywhere you have jobs for these things. So, what is the career prospect after you do, say, a CYT training? And this is just a small slide just to give you understand. As I said, VA, 84% of VA site offer yoga. They take people who are yoga trainers, they take administrators for various clinical roles, they do telehealth. Most of the hospital and clinics, as I told you, all the cancer hospital in this country, what the name, have yoga departments. They have yoga therapists, they have professors. There are yoga professors at MD Anderson, a complete professor for last 30 years in yoga, doing research in yoga. So it's a very important field, and the numbers are increasing every day. So those are the ways you can get a job after getting your CIT trained through Vayu. And of course, you can do your own private practice. You can sit at home and start virtual courses, work at the level of the community, depending on what sort of lifestyle and how much money you want to earn. Demand. Very important. So fitness instructors, the closest official category I just saw in the labor market, the project development is around 12% in the next 10 years. That's a huge, with a median wage of at least $50,000. And so that is the lowest category. That is the only closest official category that I could get for this. So don't forget, there are other categories which I didn't even search. So even the lowest category is projected to grow within the next 10 years by 12%. That's a huge growth. And that does not include the special positions that I said, like as consultants, as private clinics, as teachers in academic institution teaching yoga, assistant professor, associate professor, or professor, or in schools of public health, or in community. It doesn't include all those. These are just lowest level fitness trainers, and that too, there's a massive projection by the labor statistics in the next 10 years. So, of course, there are national NIH, which is funding bunch of studies in clinical trials, and there are studies that increasing every day. As I said, over 1,000 paper comes out, so you can be part of those research trial. Now that there are such big research trials that people actually have started taking program research coordinators. Olden days, we had research coordinators in medical subjects like for drugs. When I was in medical school, now they have started taking clinical research coordinators who are trained in yoga because their research is on yoga. So you cannot take a guy who's trained, say, in pharmaceutical to be running a clinical yoga therapy program. You can't. So they have to take a CYT trained person, and that's the job that you are going to get. Whole person health, we already talked about, medical schools, hospitals. So what are the courses that we do for Vayu? We do very, very important courses that will make you a core clinical practitioners of yoga. And we start from the basic. Why? These courses are not meant only for doctors. These courses are meant for everybody with absolutely no clinical knowledge of yoga. You need to have just a basic degree. You can class after you pass standard 12, you can start doing these courses. This is part of the core courses, so you can take a clinical. If you want to practice in America, earn a starting salary of 60 to $80,000 and a salary not less than 120 plus in the next 5 years, or start your own clinical practice. These are the courses you need, and we call those clinical yoga therapy courses. 404 is the basic, the numbers might change. That's the basic course or foundation. Here we teach you the basic anatomy. We don't want to make you a PhD in anatomy and physiology. You don't need to. Even as doctors, I use 1% of the anatomy physiology I studied in my first year of MD. Why? Because we don't need that amount of anatomy and physiology. So courses are getting changed nowadays, even in modern medicine. We teach you the basic anatomy and physiology that you need of cardiovascular system, neurological system, endocrine system. We explored the commonest non-communicable disease. If you have 10 patients, 8 of them will be hypertension, 6 of them will be diabetic, 9 out of them will be diabetic and hypertension combined. A bunch will be having mental problems. A bunch will have back pain. So you need to know these basic diseases, which we are going to teach in 404. 405 will teach you the other therapies. What about people with uncontrolled diabetes? What about people with cervical spondylosis? And they are millions in number. What about people with asthma? Asthma have inflammation in their lungs. Practice of asanas and practice of breathing techniques cures asthma. There are tons of studies on that. What about people with musculoskeletal disease? What about people with cancer? How will you treat cancer patient during their chemotherapy? Those are taught in 405. In 406, we teach you clinical theory to bedside, which means we give you the final understanding of the fundamentals of research and clinical study. So next time somebody tells you, oh, yoga is some voodoo, yoga is some religion, yoga is some nonsense, you can tell them by actually showing medical research that yoga is evidence-based clinical practice, and that's what we are going to do. Nothing is non-clinical, nothing is non-evidence-based. It's completely yoga-based. So we cover you on everything: cardiovascular disease, stroke, diabetes mellitus, all the common diseases, mental diseases, so that through the 3 courses, you get to do everything. The other important part of the courses, which I have not mentioned, for example, in 404, we do clinical patient labs. What does that mean? You are given a clinical case. Suppose you have a patient of hypertension. So you get a clinical case that Mr. XYZ is a 56-year-old African American male with history of hypertension. Last blood pressure was 160 by 110. Having this diet, he had an echocardiogram which shows this. So how will you treat him? So we do practical clinical, in between the theoretical courses, we do practical clinics so that you actually understand how you do it in clinical practice. 405 has 3 clinical practices so that you learn diabetes, you learn other medical disease like rheumatic disorder, lower back pain, neurological disorders, how you do it. 406 has even more clinics so that you understand how you deal with patient in your clinic. When you see a patient, what are the dietetic things you'll advise? What are the medical things you'll advise? What are the lifestyle modalities you'll advise? So those are the things we do. We have 2 powerful courses coming up for people who are already practicing as yoga therapist, and you can take this as part of your MS or even part of your PhD. If you want to do a PhD in clinical yoga therapy, where you'll harness the power of vagus nerve. Vagus nerve itself is a $1 trillion business. Why? Starting from heart failure, I'm one of the cardiologists who puts in a device that costs over $35,000, and the whole process takes about $100,000. And the device is called Barostim. These are in severe heart failure patient. We put in Barostim to increase vagus nerve so that their heart failure improves. You don't have to do that. Why? You're teaching them to improve their vagus nerve from day one. So they'll never ever develop heart failure. They'll never ever develop coronary artery disease. They'll never ever develop uncontrolled hypertension. These are the diseases that cause this. So we will teach you. There are small devices that cost $300, $400 to stimulate your vagus nerve. Whereas you can sit in your home on your own bed, on your own sofa, do Ujjayi breath for just 7 cycles, and your vagus nerve will start beating faster. You'll have more vagus drive. You do left nasal breathing, or what you call Chandrabheda Pranayam, for just 60 seconds, and your vagus nerve will improve. So we have the power in our hands. You don't have to pay money for it. You don't have to do any costly, you don't have to spend your pocket money for it, or go for any costly devices, get to a hospital and get a massive surgery done to implant a Barostim device. No, you can sit in your home and teach patients and take your consultation fee for the same. We are also teaching research methodology. As we said, in the last 10 years, we have had some of the biggest paper. During COVID, we produced a paper that was published in the Springer Nature Journal. Nature, most of the Nobel laureates published there, where we showed that yoga can not only prevent COVID, but once you have COVID, and that time we didn't even have enough research in yoga, but based on research in other subjects, we showed that how you can prevent COVID because yoga prevents inflammation, yoga improves your immunity. And that article was viral. I mean, there are hundreds of people who have copied that article, who have used that article in their research. I think 17 or 18,000 downloads of the article. And I'll show you a book also that we came out, and those books. That book is these 2 books have millions of downloads. Let me share the screen. This is our first book.
Indranill ji, just a quick question. So just to set expectations so that another,
I'm done. This is my last slide.
Thank you, thank you.
Okay. So this is the first book that came out in 2022. Here, we have talked about everything in cardiovascular disease. And in this book, what we did is, this book is written by 75 authors all over the world. They're all allopathic doctors. Like Greg Fitchion is the executive director of psychiatry at Harvard. So they're all top allopathic doctors with research in yoga. So each of the chapter has got over 200, 300 references. So yoga, remember, is one of the most researched subject in medicine. So if anybody tells you yoga is voodoo, slap him on the face and tell him, my friend, get yourself more educated. These books are available in Amazon. If you do, and these are for doctors and for yoga therapists and for people who want to practice clinical yoga therapy at whatever level, whether you're a massage therapist, whether you're a nurse, or whether you're just a yoga teacher who wants to understand yoga and teach yoga on a scientific basis. The second book is published by Elsevier, which is the world's #1 medical publisher. And again, this book is written by over 45 different specialists. And again, we cover all the diseases um, in yoga and all the diseases, whether ischemic heart disease, hypertension, diabetes. So with that, I'd like to finish my talk.